Chapter 3 is all about reagents that are used in the blood bank. You'll notice on slide 4 in Chapter 3's PowerPoint presentation that there are 4 different types of reagents that we use in the blood bank lab. The first type is anti-sera. Anti-sera means antibodies in a bottle. In MLT intro course in Phase 1, you were introduced to anti-A, which is an antibody that will bind to antigen A on a person's red blood cells if they have type A blood. Anti-B is an antibody in a bottle that will bind to antigen B on red blood cells if they have type B. Both will bind if the person is type AB. You've also previously seen anti-D. Anti-D is how we determine if a person is Rh positive or negative for their blood type. This antibody in a bottle will bind to antigen D on the blood cells. There are, however, up to 300 different antigens that can be present on a person's blood cells. So there may be a situation where we need to know what other antigens are on a person's red blood cells for purposes of transfusing them with someone else's cells. So for that reason, I have this rack on this side that has all kinds of other anti-sera. So there are antibodies that can be on a person's blood cell that are known as little s. The little s has a line over it, and that shows us that it's a lowercase s, and this bottle has in it antibodies that will bind to the antigen little s. There's also an antigen known as M. The antibodies in this anti-sera will bind to the antigen M. One last example is Duffy B. The Duffy blood group system is shown as an FY symbol, and anti-Duffy B are antibodies that will bind to the antigen Duffy B. So there are multiple different types of anti-sera that we can use in the lab. One specific type of anti-sera that we use for an important test, known as the indirect antiglobulin test, is an anti-sera known as anti-human globulin. Anti-human globulin is an anti-sera. It can be colored green, and that's what we use in our lab, that has antibodies in it that will bind to any human IgG antibodies. So it's an antibody that binds to human antibodies. It can also bind to complement C3. So we have anti-sera that help us to detect if an IgG antibody is present in a person's plasma, because these antibodies help the IgG cause agglutination by cross-linking cells. We will learn more about that test tomorrow in lab. There are anti-sera that have just the antibody to IgG, or an anti-IgG. This is still known as anti-human globulin, or AHG. Or we can have antibodies that will bind just the C3 that may be present on a person's red blood cells. The third type of reagent we use are known as reagent red blood cells. And so you can actually see that reagent red blood cells are bright red. And these bright red cells are so bright in their color because it is a 3 to 5% suspension of red blood cells in a saline solution. So when we type a person's blood, we type their red blood cells using anti-sera to see if they have the antigens, but then we also test their plasma to see if they have the expected antibodies. A person who does not have the A antigen will have A antibodies, and when we mix that person's plasma with these A red blood cells that are reagent cells, it will cause agglutination. People that do not have the B antigen on their cells will always have the B antibody in their plasma, And when we mix their plasma with these B reagent red cells, we will see agglutination. There are also some red blood cells known as check cells or Coombs cells that make sure that our anti-human globulin can actually cause cross-linking of red blood cells. So it's kind of like our quality control to make sure our AHG is working. Another type of reagent red blood cell is the reagent red blood cells we use in the antibody screen. Notice it says antibody screen on all of these cells, and we use these 3 cells in a test to see if a person has antibodies other than anti-A or anti-B. If somebody has antibodies to an antigen like little s or M or Duffy B, then they can be detected by mixing that person's plasma with reagent red cells that have those antigens on the cells. We will learn more about this test later in the class, but we use reagent red cells to test a patient's plasma for antibodies we do not normally expect to be there. If we do detect any antibodies there, we can't tell exactly which antibody it is using just 3 cells, so we will actually perform a full antibody panel. So there are 10 different reagent red blood cells in this test, and using these 10 different cells, each one mixed in a separate tube with patient plasma, can help us determine what exact antibody that person has in their plasma. The last type of reagent that we cover in the lecture for Chapter 3 are known as potentiators. Potentiators increase the potential of red blood cell agglutination or cross-linking. So they enhance antibody attachment or help agglutination occur. We've already talked about one of these, and that is LIS, low ionic strength solution, and this brand Ortho calls it enhancement solution, but it is low ionic strength solution. We also mentioned PEG, bovine serum albumin, and enzymes as other potentiators in our previous lecture. They are discussed more in depth in Chapter 3. As we go through the rest of this course, you will be watching videos that may or may not have been actually produced by myself, but those videos are going to use these different reagents in those different types of tests that will be performed in the blood bank.